Welcome to Drugs in the Brain. I'm Dr. John Duncan. Today we're going to talk about some more of the drugs of abuse. Specifically, we're going to talk about benzodiazopines, alcohol, and PCP. We're going to look at how they work and how they affect the brain. Benzodiazepines are very common drugs that are prescribed by psychiatrists and doctors. Valium, Xanax are a couple of examples. They are called GABA modulators. They increase the strength of GABA in the brain, and these are drugs that slow the brain down. Benzos are the most abused pharmaceutical drugs in the United States, but they're often prescribed most by psychiatrists and doctors, and they're often diverted to non-therapeutic use. On the left, we can see a brain of an anxious person, a person suffering from anxiety. On the right, we can see that same brain after treatment with benzodiazepines. We can see that it's down-regulated. It's moving slower. It slows the brain down. That's what GABA does. Let's look at how it works on a neurological level. This is a typical neuron. We've seen this diagram before. It has axons. It has dendrites. And these intersect in the form of synapses, where chemicals are transferred from the axon and received by the dendrite to cause cellular changes. In this case, let's look a little closer at this diagram. We can see the axon of the synapse, the dendrite side, and we can see GABA being released. Cell is stimulated, polarity changes, neurotransmitters are released, they're received by the dendrite, and they cause change. Up close, we can see also the ionic channel that reduces activity on downrange in a glutamate neuron. So as GABA binds to this ion channel, it activates and slows down that particular nerve, which in this case was a glutamate nerve. This is an up-close diagram of that ion channel, and we can see various binding sites, things that activate it. GABA, of course, benzodiazepines also, alcohol, ethanol, neurosteroids, and barbiturates. These all activate and open the chloride channel in the brain, and that slows it down. All activity in this ion channel are associated with inhibiting what happens downrange. They open the chloride channel. Other drugs stop this. GABA is the major inhibitory neurotransmitter in the brain. Glutamate, on the other hand, is the major excitatory neurotransmitter. You can see the GABA system goes throughout the brain, and it slows areas of the brain down. It may do this by actually slowing down glutamate pathways, glutamate release. GABA turns glutamate off, slows the brain down, calms you down. But how is this addictive? It's addictive because GABA gives us a behavioral reward to the ventral tegmental area. It decreases dopamine stimulating glutamate and inhibits neurons that control slowing down the release of dopamine in the ventral tegmental area. Therefore, it stimulates the nucleus accumbens and gives us a reward. That's why benzodiazepines are addictive. Benzodiazepines, barbiturates, alcohol, GHB, ketamine, PCP, and opioids are all examples of drugs that activate GABA that in turn disinhibit glutamate neurons from the ventral tegmental area and stimulate activity in the nucleus accumbens. Alcohol works in the same manner as benzodiazepines. It sedates the brain from the outside inward. Higher cognitive functions are the first to go, creating disinhibition in emotionally charged behaviors. Next, the limbic areas become sedated, leading to a sort of being spaced out. And finally, if the sedation reaches the brainstem, you die. Just like all drugs of abuse, chronic alcohol abuse has a negative overall effect on life. And we can see the results here in these brain scans from Daniel Amen's clinic of what a normal brain looks like as compared to a brain that is suffering from alcohol abuse. In this case, a heavy teen alcohol user. This brain scan compares a healthy brain to a 52-year-old woman who's an alcoholic. You can see the downregulation and disinvolvement of several areas of the brain on the alcohol side.
Next, let's look at phencyclidine, PCP. This is probably the most dangerous drug law enforcement officers will ever encounter. PCP causes psychotic episodes. At the same time, people on PCP cannot feel pain and are in a delirious state. PCP causes psychosis. Here we see a PCP abuser having a psychotic episode. Pepper spray will not work. Pain compliance will not work. Confusion, aggression, violence, paranoia. Positive symptoms of psychosis. Manic behavior. They cannot feel pain. How does this work? PCP blocks glutamate control of the nucleus accumbens, causing a hyperactivation of the mesolimbic dopamine pathway, and that leads to the positive symptoms of psychosis. We've seen this before with methamphetamine. The difference is that PCP also shuts down the pain receptors in the body. PCP blocks the NMDA receptor, which is a slow-acting glutamate receptor. When the glutamate receptor is blocked, all the excitatory parts of the brain are shutting down. all except for the mesolimbic pathway. In doing this, PCP creates a pain shield. People are not able to feel pain or respond to it. They're also in a delirium. But the mesolimbic pathway is hyperactivated, so they're having a psychotic episode. Very dangerous mix for law enforcement officers encountering a suspect on PCP. In this slide, we see how the mesolimbic overactivation results in the positive symptoms of psychosis. Here we have a little devil talking to the head because we have overstimulation. PCP causes this overstimulation, hyperactive release of dopamine in the mesolimbic pathway, leading to those positive psychotic symptoms.